In this country, 800,000 people suffer from strokes. In today's HealthCast, Local 10's medical specialist Christy Kruger has details on a local clinical trial aimed at helping those with the most devastating type of stroke. Christy.
Well, strokes of the brain actually are divided into two different types: small vessel, which people tend to recover from fairly well if treated promptly, and large vessel strokes, which are much more difficult to treat. Dr. Brijesh Mehta is part of a team with Memorial Healthcare's Comprehensive Stroke Center, and they're taking part in a worldwide study. It's called the DAWN trial. Typically, patients who present with this large vessel blockage need to be treated within 6 hours, either with surgery or with medication. But researchers are hoping advanced imaging may extend that window of opportunity for clot removal.
The time is still important, but there are a subset of patients, about 20 to 30% of patients that present with large vessel strokes that unfortunately present, in these later time windows, and before there was nothing we could offer them.
And also in today's HealthCast, continued concern about the increased risk of stroke for people who routinely take non-steroidal anti-inflammatory medications. You probably know them as NSAIDs. Well, here's the problem. Anti-inflammatory medications contain ibuprofen and naproxen have been shown to increase stroke risk, cardiovascular disease, stomach problems, and even kidney failure, even if you are taking very small doses on a daily basis.
Which begs the question, are there alternatives? Are there other things that one can use to help reduce pain and fever and inflammation without carrying the risks, long-term risks of these types of medicines?
And the answer is yes. Cardiologist Dr. Adam Flavor says there are alternatives that can really help with pain and inflammation. Things like omega-3 fatty acids and an herb called turmeric. Those are really good. Even age-old aspirin may be safer in some cases. And it's important to know that even so-called natural medications come with some side effects, especially when they're combined with other medications. For instance, too much vitamin E can increase your risk of bleeding. So before you start taking any supplement or any over-the-counter medication to treat a problem, talk to your doctor or your pharmacist to make sure that there isn't going to be some sort of a potential side effect. With your HealthCast today, I'm Christy Kruger, Local 10 News.